All right. This press conference will be recorded. I'm going to start the recording now. All media have permission to record as we're in this press conference. Additionally, we will be sending a recording of the press conference to the press list immediately following the press conference. So I'm going to give people one more minute. Okay, we'll go ahead and begin. My name is Lannister Smuggiing, and I am the lead organizer for SEIU 1199 New England. And we've called this press conference today for really a very serious matter. Yesterday, we sent strike notices to 3 of the nursing homes that we represent. That includes Hopkins Manor, Pawtucket Nursing Home, and Greenville Nursing Home. We didn't do this lightly, and we've done this after really trying everything that we could to reach an agreement that would be beneficial primarily for our residents. We sincerely want all nursing home residents in the state of Rhode Island to receive the best care that they can. And we are very hopeful that our main issue, which is safe staffing, can be resolved and guaranteed for all nursing home residents in Rhode Island. It's far past time, but after months and months of working to pass legislation that would protect all nursing home residents in Rhode Island, our members have taken the strong decision that they have to do what they can do for the residents that they directly represent. And it's been 13 months now that we've presented our demands to the owners of the nursing homes that we represent. We have given them ample time to respond, and to date, the nursing home owners have not responded. Months before the pandemic began, we were clear and we made it clear that we could not continue the current situation where our residents are not guaranteed basic standards of safe staffing, and that this issue was prime for us. While we continue to support safe staffing for all Rhode Island nursing home residents, our members have decided that the residents in their nursing homes can't risk the continued status quo any longer. And so they must be willing to strike for the good of the residents. And they have sent a strike notice with a strike deadline of 6 a.m. on July 29th. This is enough time for the employers to do what's right and to really put the residents and caretakers on the forefront, and this issue can be resolved. But thus far, they have not shown the will or the desire to do so, even after having come through so far this horrendous pandemic and the massive deaths in Rhode Island nursing homes, while caretakers have been heroes throughout. Everyone in the country has recognized the heroic work of nursing home caretakers. It's time for them to receive the tools that they need. Thank you signs just aren't going to cut it anymore. It took a lot of courage for our members to continue to go to work during this pandemic. And now they're displaying the courage to not go to work, to interrupt what is truly a lethal business as usual. And they're doing it for the residents. We can't call people heroes while we keep them in poverty. We can't call people heroes while we don't do the bare minimum to give them the tools that they need to save and take care of nursing home residents. And it is because of that that we have taken the very serious step of having votes and issuing a notice that we will be going on strike if the issues are not resolved by July 29th at 6 a.m. We don't do this lightly, but we do this united. Hundreds and hundreds of nursing home workers voted last week on whether or not to strike. And out of hundreds, less than 10 were not ready. Hundreds united have said that they just can't let this continue the way it's been going. Last week, we heard at a hearing on a bill that we support for safe staffing, dozens and dozens of nursing home administrators say that there is no staffing crisis. Dozens and dozens of nursing home owners and administrators say that they just want more money. We know the truth. We know that over the last 2 years, nursing homes in Rhode Island have made over $241 million in profit. And on top of that, in the last 3 months, they've received an additional $60 million in funding. That includes a 10% Medicaid increase that started at the beginning of April, and that includes $29 million in additional funding from the federal government through the HHS, where every single nursing home in Rhode Island received $50,000. Also, every single nursing home in Rhode Island received $2,500 for every single bed that they have licensed in the state, whether those beds are empty or full. What that amount of money alone represents is twice the annual funding that they normally receive, on top of the funding that they already received. So their cries of poverty, while our members literally worry about how they're going to pay the rent, their cries that they need more money while our members don't know how they're going to take care of their family's basic necessities. Their claims that there's more than enough staffing while they stayed home and continue to stay home during this pandemic, but our members have gone to work every single day taking care of the residents in Rhode Island that deserve the best possible care, while our members have risked their lives, risked their families' lives, and done everything possible. These nursing home administrators have the gall to claim that we don't need safe staffing, that everything is fine. That's very easy for them to claim while they have stayed at home during this pandemic, and our members have gone to work every single day. Some of our members have paid the ultimate price. Many members have been sick with COVID. Many have been hospitalized. I've heard reports recently of members who had been in ICU, one member who even had a stroke as a result of COVID. And at one of these nursing homes, Greenville Nursing Home, where one of our members died. So it really is just offensive, the fact that these nursing home owners aren't putting residents and the caretakers who provide care every single day ahead of their own profit. There's no reason why we can't have safe staffing. We are demanding 4.1 hours of staffing per resident for every single resident in our nursing homes. We hope that the state will do what's right, but members have decided they can't wait any longer. And what we have control of as members of a healthcare union is the unique ability to put into our contracts measures that will directly protect and care for our residents, and that is what we have decided to do. First today, I'm going to call on Stefania Silvestri, who is a nurse at one of the homes that has voted overwhelmingly to go on strike, Greenville Nursing Home.
Hi, I'm Stefania. This was a last resort. None of us want to strike, but it's important that we show them we're serious. They have been stalling for quite some time now, and we need support more than ever. If there was an alternative to this, believe me, we have tried to reason and we have tried to settle, but there has been no other solution. It's not an easy decision. We just want to show them how important it is and how detrimental this is to have safe staffing and to give those caregivers a good wage to support their families as they're risking their lives and their families' lives. And they've given up a lot to go to work every day and to care for our most vulnerable population. We want to provide the residents the proper staffing and the proper tools to care for them the way they deserve to be cared for. This is what's needed to move forward. We have to do this to show them we're serious. We need them to take us seriously. No more stalling. And that's about what we're fighting for. We want them to know we're serious.
Thank you, Stefania. And I should have mentioned we will be taking questions at the end. Next, I want to call on a CNA who has given years and years of service for her residents. She works at Hopkins Manor Nursing Home, where the employer has refused to even give us a date for bargaining. Hopkins Manor recently sold for tens of millions of dollars, yet the employer doesn't have the time of day for the heroes that have been working every single day and have gone through what has been a tremendous crisis and a huge outbreak at their home. So next, I'd like to call on Dawn, again, a CNA at Hopkins Manor, one of the nursing homes that voted overwhelmingly to go on strike.
Hi, my name's Dawn O'Clair. I'm a CNA at Hopkins Manor for the last 20 years. When I came into this field 20 years ago, we had a fairly good, we have 8 residents that was, reasonable to take care of. But over the years in time, the amount of work and the acuity that has been laid upon us has been a lot. We're short a lot. Our patients do not get the care that they need, and they deserve the care that they need. They're here in an institution, and they need us. We don't want to strike, but we are going to strike because it's time that our employers step up and give our residents what they deserve and what they need. Our elderly has worked their whole life to build this state and the country to where it is. And now they're getting nothing. They're getting no kind of quality care. Then when the COVID came into my building, I really seen it wipe out our building bad. We had a lot of staff that was sick. We had a lot of residents that passed. And people don't understand that this job is a very emotional and physical job. We had to bag our residents as they passed, which is not easy. We hold their hands as they're passing when their family could not be here for them. So at the end of the day, they really deserve the quality care. They do not need to be treated like they're on an assembly line. And I gave up My daughter went to go live with her father when we got hit with COVID. I put my life on the line every day with having asthma and COPD to take care of our loved ones in this nursing home. And, our wages, 20 years of service, I make $16.35. I have raised 5 kids living in poverty, working 6 to 7 days a week just to make ends meet. That ain't fair to me. That ain't fair to my family. And after 20 years, that's nothing. And I gave it up a lot of time to be with my family, to be in my job. During this COVID, we were heroes. We need to keep being treated like the heroes that we are. I mean, we've gone through a lot, especially these last 3 months. And it's time that we get change, and we deserve change. And we need change now for our residents and for the tools that we need to take care of our residents. And, our employees are not in no means trying to reach out for dates on negotiations, which means everything gets delayed. And we need to get our contract and get our contract now. And this is why we're going to put up a strike. And, we need to win. We need to win what we deserve, and our elderlies need what they need to win.
Thank you, Dawn.
Yeah.
So again, at Hopkins Manor, they had a huge outbreak. Workers got sick, and those that could continued to work day after day, day after day. Whenever there was any kind of need for people to work double shifts, triple shifts, workers did it. The employer had no problem asking for that. And yet, 13 months later, the employer has not given one single date for bargaining. The workers have decided they can't let that continue. Next, I'd like to hear from Dennis. And Dennis is a longtime CNA at Pawtucket Nursing Home, a place where, frankly, many of the staff are in the highest population for risk of contracting COVID, and yet every single day they have continued to work. Go ahead, Dennis. You probably have to unmute yourself.
Okay.
There you go, Dennis. You're good.
My name's Dennis Hasset. I work at Genesis in Pawtucket. I've been there for 40 years. I come in every day with COVID in the building. I'm 63 years old. We need to have decent staff in the building taking care of the patients, because these patients deserve to have decent staff in the building. We deserve to have decent staff in the building too. And all the patients that are there don't have COVID, and we're the ones in the front line taking care of these patients. When administration, they don't come into the building. If we have to talk to them, we have to call them on the phone because they won't come in the building, but we're in the building. We're in the building every day. Most of us are in the building. We don't call out. We're in the building taking care of patients which they should be taking care of, because they're elderly and we should be taking care of the patients. All the workers that are there, most of them have been there for a long time, and most of them are in their 60s getting ready to retire. And the management, they don't come in the building at all. When we need something, we have to go to the union to call them. Let's see, what else do I want to say? Management needs to know that we're not joking around. We need safe staffing in the building. We need better wages in the building. We need better health benefits, because if we get sick, we need to have good benefits, because that's what, if we get COVID, that's what we're going to need. So if we don't get this, we will strike. All the members in the building, they're ready to strike. And management needs to know that. Management needs to know that we're not joking. We've been waiting for this for a couple of years for safe staffing, because it's terrible now. When there's a call out, we have to work short. None of management comes in to help, and some of them are nurses, some of them are still have a license to pass meds, but they won't help. They just tell us, you have to work short. And that's not right. It's not right for the workers. It's not right for the residents, because these residents deserve to have proper care. They shouldn't have to wait 5 or 10 minutes to go on the bedpan because there's not enough staff in the building. And they should be able to have showers when they want them. They shouldn't have to wait for us to pass the trays out because there's not enough help. And they should have, their meals shouldn't be cold. So we need to let management know that we're not joking. We're serious this time about going on strike. And go ahead.
Thank you, Dennis.
All right.
So again, we'll be taking questions in just a moment. If you are with the media and you have a question, please type into the Zoom chat, or you can use the button on the bottom, reaction button, to raise your hand. So these are 3 of the nursing homes that we represent in the state. We have taken strike votes at all of our nursing homes, and it is quite possible that we will be issuing further strike notices at other nursing homes in the state. This Thursday, we will be having informational picket lines at all of our nursing homes. We'll be sending the information out together with our press release immediately following this press conference. This is very serious. We do not take this decision lightly, but there comes a time when you have to say things have to be fixed. And Healthcare Heroes means that you take care of residents when you're able to take care of residents, and when management has put every barrier and there's a lack of regulation from the state that ensures that residents get the best care that they can, that you have to do whatever it takes to make sure that your residents are taken care of. So first I'm going to be calling on Scott Cook. 1 second. Scott, please go ahead.
All right, can you guys hear me?
Yes.
Okay, great. So what happens, let's say, if by July 29th at 6 a.m., nothing has been done, nothing happens with ownership, and these caregivers do decide to strike? What then happens to the residents of these nursing homes, who, I guess, is caring for them at that point?
Yes, that's a great question. First, let's be clear. These workers have decided to strike. The ball is now in the boss's court. The bosses have the ability to do the right thing and take care of residents and the caretakers who provide their care. We have provided 16 days of notice. The law requires 10 days notice. We provided an extra 6 days so that the employers can come up with their emergency plan and try and secure additional staffing to cover the time when workers will be outside on the picket lines. I will say that it is tragic that the nursing home owners, I am certain, will find staffing to replace the caretakers who have risked everything for their workers, and yet they are unwilling to respond to the demand for staffing so that residents can get the best care that they deserve. All right. Next, I see Bill Bartholomew's hand up, and you're unmuted.
Good morning. Thanks for doing this. All right, my question is pretty straightforward. What's your message to anyone who may cross a picket line to work in any of these 3 nursing homes, or more, if potentially more end up striking? What's your message to someone who crosses the picket line? Because this is an unusual situation in which those 2 would defy a strike, whether they're a temp worker or someone potentially from your ranks, may value the caretaking component of the role that they would be serving more so than their own union protections and their own workers' rights. So it's a difficult balance. Understanding you're striking, what's your message to those who would cross this picket line?
So first, let's be clear that in the nursing homes where we've had the strike vote, out of hundreds and hundreds of workers who have voted, less than 5 voted no. Second of all, it is not our desire for nursing home residents to not receive care. We will not in any way violate the law in a way that intimidates or prevents workers from providing care. Our message, though, is that what is really needed, if you really care about the care of these residents, is to put pressure on the management to do what's right, to do what they can well afford, which is provide the care that, frankly, they're paid for. They're paid millions and millions of dollars to provide resident care, and our demands, frankly, are that they do what our tax dollars pay for them to do. Also, those that are concerned about the staff, about the residents in these nursing homes, there is still the hope, and we continue to work every single day that the law will be passed that would grant safe staffing and protections to every single nursing home resident in the state. That power is within the hands of the state, and we simply are faced with the choice of whether or not we can wait for that, or we stand up and say that the business as usual status quo is too lethal and we're not going to let it continue where we have the power to stop that, and that is in our nursing homes.
So if I could just quickly follow up, have you had ongoing conversations from either a lobbying perspective or just from, an off record? What do you think? Do you think that is going to be passed before you hit that deadline, July 29th deadline?
I think it's no secret that we are leading members of the Raise the Bar campaign, which is the Coalition for Safe Staffing. We continue to work every single day to get that legislation passed. We know that there was a hearing in the Assembly last week where over a dozen nursing home workers testified about the urgent need for it to be passed, and the bill is still alive in the Assembly. Yesterday, the Senate held a hearing, and it was voted out of that hearing unanimously, and I believe is now posted for a vote on the floor of the Senate in the next few days. The Assembly and the Senate have every ability to meet and to pass this law, and we hope that they do, not just for our own members and residents, but that they do it for the residents in every nursing home in the state. Again, that ball is in their court. We don't have complete control over that, but as healthcare workers, what we do have control over is the labor that we provide or that we don't provide when the situation is just too sick to carry on. I don't see any. Oh, sorry. There's a question in the chat box. That was already answered. I don't see any further questions. Again, if you would like to ask a question, please use the chat box, or you can use the reactions button And I will quickly scroll through to see if anyone's waving their hands frantically. And it appears that they're not. So again, we grant full permission for any part of this Zoom meeting to be recorded and publicized. We will be sending a recording out shortly. This Thursday, we're going to be having informational pickets at every single one of our nursing homes in the state. That includes Greenville Nursing Home, Charlesgate Nursing Home, Hopkins Nursing Home, Lannister Nursing Home, Pawtucket Nursing Home, and Aldersbridge Nursing Home. We represent workers who take care of hundreds of residents in the state, and it's time for them to be heard. We welcome any community support that would like to come to the informational picket lines, and we encourage people to let employers know that they support workers, and to let the state know that it is really a crisis that must be solved, and that can be done in part by passing our legislation. Thank you, and have a good day.